Okay, let's go talk about cardiac output in the time we have left. So what is cardiac output? Well, it's what your cardiac puts out, right? Okay, that makes sense, but what is that? So cardiac output is a rate. It's actually the amount of blood, the volume of blood you pump by each ventricle during 1 minute. So it's not both ventricles, not the sum of both ventricles. You're either looking at the left or right. And the thing is that in normal healthy heart, you should have the same amount of cardiac output in both the left and right, because the thing is that if the left is strong, has more cardiac output than the right, it's going to pump more blood toward the right side. If the right side has more cardiac output than the left, it's going to shove more blood towards the left side in lungs. So usually in healthy hearts, they're about the same. And what we have here is units of volume. So it's either milliliters, more typically liters per minute. And how do you calculate it, or what? The way you get your cardiac output is that you have your heart rate, which we just covered, multiplied by the stroke volume. So stroke volume is how much blood ventricle pumps out with each beat. So again, heart rate is beats per minute, multiply it by volume over beat, and now you have volume over minute. So then we talk about chronotropy, which just refers to how fast the heart is beating in very layman's term. So it refers to your heart rate. Again, we covered tachycardia, above normal heart rate, and then bradycardia, below normal heart rate. So how can you change your heart rate? So you know your heart can beat by itself. And I did include that previous disclaimer. Does that mean your heart is completely independent of all your brain and other organs? No. So your brain can affect your heart. So what we have here are sympathetic cardiac nerves and that so important vagus nerve of the parasympathetic system. So in general, the sympathetic nervous system is like the gas pedal for your heart, and the vagus nerve is kind of like the brakes for your heart. But what do they do to the cardiac tissue exactly? So one thing they do is affect the pacemaker cells in your heart. So here we have a normal pacemaker potential, and then what we have here is the prepotential. So remember, the pacemaker cells, they can push themselves to threshold, do an action potential, push themselves back to threshold, and do the same thing again. Well, with sympathetic stimulation, what do we notice here? So the thing about sympathetic activity, what it does is makes it easier for these cardiac or pacemaker cells to go to the threshold. So it actually shortens the time to that threshold. So by doing that, you can fire off more action potentials. Like look at here, we have maybe like 3 or 4, then maybe 3.5 action potentials. But by increasing the time or decreasing this prepotential time, you actually have more action potentials over here. AED with someone with a pacemaker. Ooh, that's actually a really good fact question. Oh yeah, so it's like, ooh, especially like, yeah, because pacemakers have metals. So yeah, that might be a very good one. So parasympathetic, yeah, but we have to get through this part. We have to talk, cardiac output is important. So parasympathetic stimulation, what do we notice here? Notice this prepotential is now longer. So instead of shortening it, the parasympathetic system is going to delay it. So one way it does is open up these potassium channels that allow so the potassium channels open. It makes the inside of the cell more negative. So this is what we have with the parasympathetic stimulation. So now we have fewer action potentials because you prolong this prepotential in a pacemaker cell. Yep. So what we have here is cardiac output, and then again heart rate times stroke volume. So one way you can change your cardiac output is by your brain. Your brain can dial up your cardiac output by increasing your heart rate, or it can slow down if you're exercising or something, how does it bring it back down? It can decrease your heart rate, thereby bringing your cardiac output back to normal levels. And let's see, do I have time for a top hat question? Probably don't have time for a top hat question, but if I did have time, this is what I would ask. All right, so I would ask like, okay, calculate, so say your stroke volume is 70 mils, and then you have resting heart rate of 60. What would be your cardiac output be? And say all of a sudden you go from that heart rate of 60 and you start exercising, and now your heart rate is 200. while your stroke volume still stays 70 mils. What would it be? Well, if heart rate goes up, your overall cardiac output goes up. So that's how I want you to know. So cardiac output, that's the amount of blood pumped by each ventricle during 1 minute. And then cardiac reserve. So this is an interesting thing. This is the difference between your maximum cardiac output and resting cardiac output. Again, your resting is going to be around 60 to 100, but if you're exercising at full, as hard as you can, especially for you young people out there, you might be able to reach 200 or higher. So that would be your maximum cardiac output. But again, as we age, our maximum cardiac heart rate goes down. So this is why cardiac reserve can be a measure of overall fitness. Or say you have an athlete with a lower base heart rate, they can jump up to the 200s and they actually have more cardiac reserve because they have more difference between their resting heart rate and their maximum heart rate. So it can be a rough estimate of cardiovascular fitness.